dollars, you would spend it differently.
Way different.
Still working on that.
Yeah.
That'd be interesting to see.
Although my kids would support a space trip.
Yeah, if they could go, right.
Yeah.
I'm glad I'm not in charge of technology.
I couldn't be.
I couldn't either.
Check this out. That's that Port Lake fire out there.
Oh,
Creating
yes. Its
weather.
own weather. I saw that this morning.
I know it's happened up
Yes.
here too. It's times. Scary.
Yay.
Did you get it all figured out?
Thanks. Thank you.
Okay. I will call the very first in-person meeting of the Public Health and Human Services Board to call to order. Thank you for all being here. It's so exciting to be here in person. We have an agenda. Do we have any additions or changes to the agenda? Do we have a motion to approve the consent agenda?
Heck, I'll do it.
Thank you, Roger.
And I'll support.
Thank you. All those in favor?
Aye.
Opposed? Motion carries. Thank you. Now we will move on to next item on our agenda, the staff report from our public health subcontracted programs at Sawtooth Mountain Clinic. And I will turn this over to Allison to do the introductions, please.
Happy to introduce our partners from the Sawtooth Mountain Clinic, Hartley and Hannah. If you want to introduce yourselves and your roles, we're really glad to have you both here this morning, as well as Grace Grenager is here as well to kind of provide perspective as well as a key linkage between our agencies and the contracted public health programs. So welcome and thank you.
Thanks, Allison. I'll introduce myself first as Hannah Miller. I'm a public health nurse at Sawtooth Mountain Clinic, and my programs within the umbrella of parent-child health are WIC and family home visiting, also the follow-along program for developmental screenings. And I'll pass it to Hartley.
Oh, it's good to see you all. My name's Hartley Newell-Acero, and I'm the outreach coordinator at Sawtooth Mountain Clinic, and I'll show you what we do. So, well, I better scoot this. So here we go. My part of it, I went ahead and did from January of 2020 through June of this year. So it's the 18-month or so period. Grace just wrote a really good article that you've probably seen about our history together, and we've been working together a really long time, and it's been a really successful arrangement. It's the Public Health and Human Services, our outreach, and then woven in there is the Child and Teen Checkup program, the WIC program, and SHIP. So they're all integrated really well. I want to start first just talking about health. I mean, we often think of it just as these individual factors of age or gender or genetics, or maybe we take into consideration individual behaviors such as what we eat, how much we move our bodies, are we addicted to anything, how well we're coping. But we don't always stop to think about the other further out ripples. And that includes the public services and infrastructure of the community in which we live. Are we able to have parks to go to? And we are so fortunate here to be surrounded by all this good green, but not everyone is. What does the local transportation look like? Economic development, those kind of things. Those are all impacted by our living and working conditions. Do we have access to food? Are there jobs? Is it noisy? That impacts an individual's health. All of them do. And the furthest out ripple are the social, economic, and political factors that then filter down through all those other levels to impact an individual's health, such as social cohesion, racism, the level of poverty that someone lives in. So the health along the bottom, it's not a small thing, it's a very big thing. And together we're all trying to impact each one of those levels. So this is what we're doing in the outreach department. One of the most hands-on ways that outreach works with people is through the blood pressure and blood sugar screenings. Now, next time I come to you, these numbers will be much larger. They'll look much more like they did in 2019. But because of COVID, our nurses simply weren't able to go out and do these kind of screenings. So we only saw 22 clients and 23 screenings in that time. They have recently started up again with, to much joy, I think the first time they had it at the Hub, the Foot Care Clinic, which is next. I only saw 28 people. There was a celebration. This also includes the enhanced maternal and child health and childbirth as the face-to-face outreach. Now, typically, in past years, we would have classes on living well with chronic conditions that Chris Angelo teaches. Those weren't able to happen. Neither was the car seat installations and coaching. But again, that's getting cranked back up. Christine Kunze handles all that, and we're about to hit the road again with car seats. This, however, is where the numbers really started happening. Everything had to happen online, and YouTube, we're up to 61 subscribers, but to me, that's really not the most impressive number. The numbers in blue are where the changes really happened. So the YouTube videos that we made and posted had over 4,000 views, up from 238 the year before. We're now having to measure it in hours. There were 222 hours viewed, up from just over 1,000 minutes. So Kurt Farshman, right there on the left, was our breakout star. Anything that Kurt Farshman was in was just guaranteed to be hot stuff. You can see that video alone had over 1,000 views. The one in the middle is a little snippet of a series of videos that were youth produced and youth targeted, and they were very well received on YouTube, but more so even on the other social media such as Instagram, where the kids live. Our nurses made made a video about masking, how to wear it well. So if you've not looked at our YouTube channel, I encourage you to check it out. There's a COVID-19 playlist that has these things specifically in it. Now, we've been doing newsletters for a long time. The Topic of the Month newsletter is disseminated in a variety of ways. You can subscribe, and if you don't, I again encourage you to do that. We have 213 email subscribers, but then it ripples out. So, for instance, here at the county, it gets sent out to employees. The GES and ISD 166 get it and then send it out. So it ripples out through the community in that way. We restarted having them out in exam rooms for people to take physical printed out copies just this last month. People can also go to our website and either read it there or download it. It's posted on Boreal, which has over 40,000 users per month. So not all of them are looking at, the topic of the month, but they have the opportunity to. I go on WTIP once a month, and I'm not sure, there again, I don't know how many, but a fair number of people hear it. And then it's in also Northern Wilds and in the Cook County News Herald. So it's not the full newsletter, it's condensed versions, but it's still there, and it always leads people back if they want the full. Facebook is, I think we've had a Facebook account for over a decade now. We just broke through the 1,000 follower mark, and I just updated this morning. We're up to 1,010 followers, so somehow that felt like significant to me, up from 660 of January of 2020. You can also see how we shifted to social media outreach primarily. In the post reach, we went from 63,000 to over 223,000. So this was our primary method of connecting with people. The local food market also has a Facebook page, and it's seeing a lot more activity as well. Instagram is new to the game, or I'm new to that game, I should say. We started that in January of 2020, and we're up to 328 followers and over 20,000 posts. And the local food market, we just started an Instagram account for that. So we haven't built a huge following yet, but we're on our way. And I'm going to hand this over to Hannah now.
Okay, exciting. Thank you for setting the tone, Hartley. Is it okay vocally if I just project like this? I think that'll be easier for me, unmediated, no masks, no screens, just voice and you. So I'll talk about WIC and family home visiting mainly, starting with WIC, which stands for Women, Infants, and Children. It is at its core a nutrition support program that focuses on the period of intense brain growth that happens from prenatal to age 5. So understanding the nutritional underpinnings of that brain growth, that's kind of why WIC targets that population. And it says women, infants, and children. Those are the people who can actually get a food package, so the grocery benefits component of WIC. But any caregiver can come with their child and receive the nutrition education component or the breastfeeding support aspects of WIC for that child. So that's the overarching kind of summary of WIC, that nutrition support in concrete grocery benefits, but also through nutrition education through a nurse, either myself or my colleague Amy, and breastfeeding support. We are both a certified lactation counselor, myself, and Amy is a certified lactation specialist. So we offer that to all of our WIC families. WIC is a USDA program, so the structure is set at the federal level, but then mediated through the state, county, and then ultimately delivered through Sawtooth for us. The cutoff, like I said, is at age 5. We enroll people prenatally. Anybody coming into the clinic announcing a pregnancy, seeking care, will set up an appointment with me. I reach out once I discover their pregnancy. They've called the clinic through our triage nurse. I reach out and offer them all of these programs that we'll talk about. Family home visiting, we'll screen for income eligibility for WIC. That's how we reach people. But we do some other outreach efforts as well for those who might move to the county after pregnancy with their young children, or who simply weren't connected initially. I mentioned the breastfeeding component through Amy and myself, but we also have a really unique peer breastfeeding support program, and this is a mom who has breastfed, a champion of breastfeeding, who really is there for that, coming alongside to offer stories, to share support, and to complement sort of the education and problem solving that we do as lactation professionals. This peer currently, Britt Malik, who has been with us for 3 months, just started, offers that mom-to-mom peer support for breastfeeding through WIC. So I've mentioned our WIC team. I am the WIC coordinator and one of the 2 WIC nurses. Amy works alongside me, and Britt Malik is our peer counselor. She works with an average of about a dozen families, and that really works out to be, she'll send out letters, texts, phone calls, at a regular basis, just to say, here I am, I'm your peer counselor, how are things going? Do you have any questions? I'm here for you. Sometimes she'll get responses back, other times she'll just trust that that the world is being filled by that good energy. And so when I meet with people for WIC as well, I'll say, how's your contact with your peer counselor been? Have you been getting those texts? Have you needed those services? So that's how that's been integrated. WIC participation in 2020 nationwide went up significantly. For us in Cook County, it went up about 14. So for our population, that is a little under 10%, but still significant. We also did not see the drop in breastfeeding rates that the rest of the nation saw. There was a large gap in breastfeeding support as people were discharged from hospitals earlier nationwide, and also not able to get the same lactation supports. But we were able to maintain those lactation supports here and didn't see a drop in breastfeeding rates. So we had really strong initiation rates at 92%, but exceeded the Healthy Children 2020 goal. Also, our breastfed at 3 months exceeded that goal. Pleased to see that. Before I move to family home visiting, I don't know, will we do questions at the end or should we stop in the middle?
Does anybody have a preference? Do you have questions right now you'd like to ask? Actually, I do have a question myself. The breastfeeding 3 months, actually, I was kind of surprised. To me, I thought that number would be higher. What is the reason for stopping breastfeeding at 3 months?
A lot of barriers come in the way, especially for our WIC population. These numbers are lower than the general population because people who are on WIC are eligible for WIC because of income eligibility. And so some of the barriers to returning to work early can really make it very difficult to continue to find accommodations for pumping, time at work. And those are things that I do counsel people on, but not every time can we overcome those barriers. So there's a significant drop. Other people have discomfort breastfeeding and have not the confidence, or perhaps haven't reached out to seek help and haven't let anyone know that they might be struggling. So that can be a barrier. If it's painful, people will stop. So those are some of the main reasons. I think return to work, lack of support, those are some reasons for that drop. But it is not seeing those numbers for our WIC population, despite being a significant drop in many people not meeting their goals, it's exciting to see that we have narrowed that so that our WIC population, because of their income, isn't seeing those levels so much below the rest of the population.
Well, it's good to know. Thank you.
Yeah.
Madam Chair?
Yes.
A follow-up question. Excuse me. Good morning. Thanks for being here. A follow-up question to that is, do you do outreach to employers to encourage them to provide accommodations for moms who want to, pump while they're at work?
So far, I haven't, and I love that idea. And right now, it is mainly the focus on that barrier has been addressing some of those conversations with an expecting parent prenatally, asking them, do you have plans to return to work? Who's your employer? Have you had any of these conversations? And I share resources with them where they can do some planning. What sorts of conversations is it helpful to have prenatally? What sorts of things will you want to have in place before you go to address those? But I haven't gone the other way by reaching out to employers. It's an interesting thought to think about how that could go.
I mean, stopping at 3 months is really not optimal, right?
No. Any breastfeeding, of course, is protective. If a baby is breastfed exclusively for 2 months, it drops the risk of SIDS by 50%. So even if we see these babies only made it to 3 months of breastfeeding, they still had incredible benefits, but not what a full year could have rendered.
I would just add that the workplace breastfeeding support is something the SHIP program could help with. So if you have families who need help with that, we're already partners.
Perfect. Yeah, thank you. Anything else about WIC before we move on?
I would just mention that within Public Health and Human Services, we have really built in pathways for referring potential participants to WIC as well through some of our economic assistance programs, some of the cash assistance programs. I believe there's like a categorical eligibility where if someone is eligible for some of those economic assistance there, they might still have to go through the application process, but it's assumed that they would have that income eligibility, and we work to make sure people are connected with all available resources.
So let's talk about family home visiting. This is another branch of the parent-child support that is offered through the clinic. And this is preventative, sort of salutogenic is the word that we are using for creating a state of health and wellness for parents as they embark on this journey, using therapeutic communication, a supportive relationship, access to informational resources and community resources, is really at the core of what family home visiting is. And it had a redefinition. We think about home visiting as a nurse myself going into a home. We got creative in 2020, and I was so appreciative of the uptake. I realized in some ways there were barriers to people letting me into their homes before, feeling self-conscious about the dishes. And I would so frequently have to say, you're 2 weeks into having a baby. Of course I'm not looking at the dishes in the sink. But I think that there were some elements of having home visits over Zoom that were really well appreciated this year. And I'll show you some numbers about how many visits there were. It was a significant increase from last year, so it seems that these programs are really taking off. So I'll give you a sense of who might take advantage of this program. Family home visiting is offered, like I said, along with WIC at any prenatal visit when I contact them and give them sort of the array of resources that they might find helpful in pregnancy. Family home visiting is one of them. It's actually integrated very well. When I have my first visit with anybody in pregnancy, it is considered a home visit. So this program really supports prenatal education of all kinds through the clinic. As well as childbirth education falls under this umbrella too. It would be a group home visit, so to speak, but held at the clinic or this year over Zoom. There aren't eligibility requirements for this, so anybody can benefit. And it's divided structurally into two branches, which does not have a huge impact on the receiving end. Families have that same basis of the supportive relationship, access to information. But from the structural point of view, universal home visiting is something that our county is really lucky to have. A lot of counties have eligibility requirements, income and other risk factors, but we're able to offer this across the board. And it is flexible. There's no commitment. People can have one visit. They can have many visits, and it's not curriculum driven. It's based on a parent's questions, needs, the issues that are arising as they go. So for universal home visiting, 2020 saw 63 total patients, 22 dyads, so parent-child combos, and 19 pregnant and not yet delivered. So 135 visits over the year was a significant increase from last year, which bodes well, I think, for the life of this program, the uptake, and that people are starting to understand how it fits, maybe not being so intimidated by the idea of a home visit. I mentioned the two branches, universal home visiting, available to everyone. There's also kind of a specialized track, evidence-based home visiting program. We use a model called Healthy Families America. So all home visiting is evidence-based in the sense that we know even having one home visit with a nurse will increase breastfeeding rates and parent confidence. But there are certain models of programs that have a lot of data behind them, really looking at duration of sequences of home visits and those impacts, especially on things like child abuse and neglect, parent confidence, and other aspects that have a building evidence behind that specific structure. So ours is Healthy Family America for now, for this past year, and I'll get to a transition soon. But this is a program that really specifically targets children who might be at risk for child abuse and neglect for whatever risk factors. There's an income eligibility feature, substance use, family incarceration, a few other things that make a family eligible for this. And it requires prenatal enrollment because they've discovered that being able to reach people prenatally, as we do for all of our home visiting, is really significant in terms of having that positive impact. Because of the intensive nature of this program, it's weekly for 6 months, every 2 weeks until a year, and then monthly after that, following families, ideally for the first 3 years of life. This program has less enrollment. People really need to feel like they would like that continued support and that intensive visiting, and I've had two families throughout 2020 who have sustained that. And I mentioned that we are transitioning to a new model, so we'll keep an evidence-based model of home visiting, but we're switching out HFA, Healthy Families America, for a new model called MESH. And this is one that I think will serve us really well in the sense that it has that same basis in evidence supporting its efficacy for families, but it will allow us to offer it more broadly, so it will be a better complement to universal home visiting. It doesn't have such a narrow, specific target population, and so for our community, it will have broader application. That is MESH. I think I've given kind of a summary of family home visiting, this sense that it is really parent-driven in terms of discovering what it is that a parent needs at any given moment. Maybe it's a connection to ECFE, maybe it's understanding what other peer support is available, maybe it's specifically focusing on a breastfeeding challenge or doing a developmental screening to really go through each question and wonder, you know, why does this contribute to cognitive development when it seems like a motor skill, and really thinking about different ideas for play and how to build those parent-child attachments. So that's how I really feel about the core of what this program does, and yeah, delight to get to work with so many families in that journey. I believe this is it for me. And I would pass it over to you unless there are questions about home visiting.
Doesn't look like it. Just raise your hand if you have a question.
I don't have a question, just a comment. Thank you for working with families and children and the new program. Does MESH stand for something?
Maternal Early Childhood Sustained Home Visiting.
Oh, okay. MESH is shorter. Sounds good.
And I used to, in the before days, office right next to Hannah, and I can't tell you the number of times as I would sit and catch pieces of conversation floating through, thinking, what would I have given as a young mom to have someone so kind and so knowledgeable in my corner. It's just what she does for the families of Cook County is, we can see the data, but I could hear the lives being touched, and it's what a gift.
Thank you.
So, child and teen checkups. Who wants to do this one? You can read. It's okay.
I can project as well.
Yeah.
So child and teen.
I'm sorry. I'm wondering about the video, though.
Sure.
Maybe you're too far away from the mic to.
Do you want to switch spots?
Sure.
Okay.
So
I just thought of that. Yeah. Sorry.
It's a combo pack. This one is, and I do the social media information. Here's the stuff, but then but it's not. We can't just separate this one out and say, oh, Sawtooth handles this, because we really work on this together.
That is it. That's a good
overview and start to, so the Child and Teen Checkups program is another collaboration between Public Health and Human Services and Sawtooth Mountain Clinic. And this is another federally funded program. Grant monies flow through the state, our regional community health board, to the county, and then we split this grant with the clinic. And the purpose of this grant is to encourage people to bring their children to well-child preventative care at the clinic. So part of the beauty of this relationship is we have one clinic. It's a clinic with a public health purpose. So by combining our outreach efforts, we're able to really reach a broad range of families in Cook County and prevent people from perhaps falling through the cracks with our outreach efforts. There's a specific focus on the medical assistance eligible population, but functionally we really target our outreach more broadly on people with children under the age of 18 to make sure that they're following up, coming into the clinic for those regularly scheduled checkups. And the purpose for that is that there's a large body of evidence and data that show when you bring your children in for regular preventative care or well child care, we're able to catch potential problems before they become large and refer appropriately so people can connect to specialist care or different types of providers as those needs arise before things get to a crisis level. So by making sure that people are coming in and seeing the providers at the clinic on the schedule that's recommended through the American Academy of Pediatrics, and following through with a really comprehensive set of, what makes a child and teen checkups visit is quite comprehensive. Make sure we check all those different boxes, get children what they need, get parents the education that they need. We're able to provide to the entire community a really high level of well child care that protects health for families and for young people in the community. So this can look like reaching out through reminders coming from the clinic to make sure that parents are bringing their kids in, that they're remembering when their children are due. As a fellow parent, I can definitely appreciate that because life gets busy and you don't always remember that your child might be due for a checkup, but the clinic does a really wonderful job through this program at being proactive and reaching out and making sure families know when it's time to bring their kids in for that checkup, making sure families know when it's time that their children are due for various vaccinations, for example. And really this is, I would say, a program that strengthens the preventative care landscape throughout the community, specifically for children. So it also can look like outreach on a community level, so participating, for example, in events like the Grand Portage Health Fair, or in the past at the YMCA, there have been events that are health fair type events to make sure that we have that broad reach to the community and say, hey, we're here for you. We're really looking forward to making sure that your family knows when it is that they should bring their children into the clinic. So.
Thank you.
Sure.
This is a program that was part of the Child and Teen Checkup outreach. Was an Instagram video series. I at the last presentation I did, I kind of put a little teaser out there and was able to say it's coming. Well, it came and it went, and I think it was pretty successful. In 2019, there was we did a program with Catherine Hansen and Kurt Farshman, Teens Questions, Doctors Answers. So questions were gathered up from our providers and parents, and like, what do kids ask you? What do they really want to know? And so the providers crafted these answers, and I made a video of our two doctors. Parents loved it, but we didn't think that so many kids were watching it, maybe. So a youth media maker took the questions, took the answers, translated them into teen, and then made a series of videos, short videos about that. We released them periodically from January to February of last year, and they were seen. On YouTube, they were seen 122 times, but on Instagram, that was the one that I was really interested in seeing how it went, because I can see, I can look at the analytics and see what age group of people are watching things, and it had 586 views, the series did. So, and that cute guy just happens to be my son. So, I did get feedback that occasionally in the halls at school, people would come up to him and say, "Dude, I saw that video that you made about peeing in a cup," you know? And so that was so I had a mole on the inside that was telling me that people were actually seeing it. So I'm a little bit proud of this one. So now, if there's no other questions about that, you just tell me when to click if you want.
Yeah, sure. So I'm Andrea, the SHIP coordinator for Cook County. And SHIP really focuses on creating healthy policies, systems, and environments in relation to preventative care. So you can click, please. Some of the areas that I say we because it's a we, but I'm the SHIP coordinator. There's no other SHIP staff, but it's still a we, obviously. That we work in is community active living, school wellness, healthy affordable food access, community well-being, equity initiatives, and commercial tobacco prevention. And then the SHIP promise and attributes are listed there, investing in local solutions for better health. And the SHIP strategies are all community-based. So they're, so I work with stakeholder groups, community members to determine what the greatest needs are in the community and build my work plan from there. So one of the programs that I work in is Safe Routes to School. So we do in-school bike education and provide resources to students for helmets. We also do walk and bike to school days and things like that. The big project that we had this year is the improvements to our Safe Routes to School bike fleet. So through a MnDOT Boost grant, we received funding to purchase a trailer and then outfit the trailer with all of the things that you need to carry and maintain bikes in it. And which included new helmets, and then we also purchased we have on order 3 additional bikes for the fleet. And then we purchased a hand cycle adaptive bike and then a 4-wheel 2-seater Joyrider that has 2 sets of pedals and 2 sets of steering. And then 2 recumbent trikes. So they're low to the ground and you steer down here. So that will allow greater access to school students who maybe are not comfortable on bikes or have different abilities. And then also the program, my hope is that if there are community members who are interested or would like to learn more about adaptive bikes, they have a few options that they can try because, you know, adaptive bikes cost a lot of money, so you don't just go out and buy one, right? And so the fleet is this close to being done. It's parked at the community center now. We just have to put a few more bikes together and put the helmets and raincoats and all of that stuff into the trailer. And that fleet will be available to any youth programs. So I reached out to all of the schools, Explorers Club, the YMCA, and just made it known that it's available or will be very shortly. So our intention is that with the trailer, we'll be able to provide greater access throughout Cook County because right now our Safe Routes to School program is very Grand Marais centric. So we would like to be able to reach up to Grand Portage and the West End and wherever youth want to go and ride bikes, essentially. You can flip. Oh, there's the bike education. Okay. So, yeah, we did the bike. You can flip back if you want, Hartley. We did the in-school bike education at ISD 166 in Great Expectations. So that's a 3-day program that includes a classroom portion where they learn the sort of mechanics of the bike and helmet fit, rules of the road, hand signals, things like that. And then we have an in the gym day where they practice those skills on an indoor course. And then the picture to the left is the 3rd day where they actually go out on the roads and practice the skills that they learned. And now you can flip. So the bike safety rodeo is typically held annually in May. We didn't hold it last year or yet this year. We hold it in conjunction with in the same week as National Bike to Bike to School Day. And then that event is a big community draw. We had in 2019 there were 79 signed participant waivers. The youth have to sign a waiver before they participate, or their parents have to technically. So 79 kids participated, but then if you think about all of their families that came, we have hot dogs and popcorn and a blender bike that, you can make your own smoothie, and there's the bike course, and at most of the events we've been able to offer helmets to youth that need them, but that's solely dependent on the money that we can gather together. So this year we didn't hold a bike safety rodeo yet. But we really felt it was important for kids. Part of the bike safety rodeo is they get their bikes looked at by a bike mechanic, right? So they get their tires filled up, or their tires filled with air, their chain checked, all of that stuff. So we decided to hold a handful of small maintenance events. So Jay Aerosmith Decoux held 3 events in Grand Marais and 1 in Grand Portage to do bike maintenance, and we were able to give out helmets at those events. And then thanks to the Operation Roundup grant at Arrowhead Electric Cooperative, so we did give out helmets and do some bike maintenance. There was only 30 participants that had their bikes maintenance compared to, historically would be 70 plus, but 30 we thought was pretty good. Yeah. Flip. So we also the Active Living Steering Committee partners with local stakeholders and community groups, and some of the things that we worked on was we held a bikeable community workshop where people were able to come and talk about the sort of barriers to biking in the community, and then we did a community ride, and then the 3rd day was to sort of talk about the community ride and what those barriers were. And we did come up with a fair list of ideas that we could do to make it to make biking around the community more accessible to people. And then once the highway project is done, we'll sort of do another mini assessment to see. We started at the Y, and we went down to North House and up to the top of the hill by WTIP, and then down through downtown and back around to GES to sort of see, what the infrastructure, how well that was supported for bikes. We also collaborated on the Cook County Transportation Plan and also the pedestrian plan, which both of those were officially adopted over the course of the last year and a half. And community gardening is active living, I think. I don't. So we also support the community garden improvements at the community center by providing funding for certain things. We can provide funding for like dirt and materials, but not the labor aspect. So we did support the increased garden beds that the community center put in. Healthy schools. So historically, outside of the pandemic, we held a weekly walk to school group, which we can start back up in the fall. Walk or wheel or roll. So we meet at a predetermined location, and anybody who wants to walk with us shows up. Parents are welcome to drop their children off if they're comfortable with that, or walk together. I also participate in the ISD 166 Wellness Committee and the Great Lunch Committee at Great Expectations to support whatever resources they might need to just, to improve their programs. Local pandemic response, that was a big one over the last year. So through the pandemic, I provided technical support to businesses in relation to their preparedness plans and employee well-being, because obviously that was a stressful time for all of us. And then I also did the volunteer coordination for the Emergency Operations Center. So these are just screenshots of the hundreds of volunteer signups that I created to make sure that the vaccination events were staffed, as well as all the way back in the beginning, I coordinated volunteers for the grocery store support. Because in the beginning of the pandemic, when all of the grocery stores closed to in-person shopping, the stores weren't able to support that capacity through their employees. So we had a lot of community volunteers that participated in packing groceries, bringing them out to their cars, greeters, a lot of support. Healthy, affordable food access. So maybe, Hartley, I'll pass it over to you. Do you want to talk about the local food market a little bit, since that's your...
Sure. So the local food market is one of the programs that falls under the umbrella of the Northwoods Food Project. And I sit on the board for that. I'm very excited about this year's market. I don't know, have any of you had a chance to go? It's just, people were so happy the first day, especially. It felt like a carnival. We average about 6 vendors per week, and I tried to count last time, and the people were there were so many people, and they were milling around, so I couldn't get a good count. But I feel like the 50 to 70 shoppers per week, we're definitely leaning towards the high end of that, maybe more. This last week, there could have easily been 80 folks that came through there. So we didn't have the market last year. It was greatly missed, and the support this year has been really wonderful.
I would add that one of the programs that I have in my work plan is food security, but through the pandemic, that's sort of fallen off. That had fallen off, but that's starting to ramp back up. So I'm sort of analyzing some of the data that was collected through the pandemic, through the extra resources that were available, like the AEOA food distributions and the numbers from Ruby's Pantry, to sort of determine, what that food access looks like and how we can work with other community groups and stakeholders and community members to sort of increase that food security aspect for people who might need it.
Yes, sir.
Hartley, what are the hours again for the local food market?
It's every Thursday from mid-June to mid-October from 4:30 till 6.
Thank you.
And it's right in the parking lot at the community center. So come on out if you haven't yet. So we've covered a lot of ground. Has any other questions bubbled up?
Wow.
Wow. Wow was right. Well, if any do, you know where to find us. Please don't hesitate to ask them. We'll get you answers as we can.
Go ahead, Commissioner Svaleson.
During our last active living committee meeting, we did come to the realization that a lot of our things that we're doing are Grand Marais-centric. And so I will say, Commissioner Storlie, we actually talked about needing to reach out to the West End, to the Birch Grove School, whether it's on the bike education things, whether it's on, we know, Andrea told us there'd been discussions before on safe routes to school, didn't see the need at that time, but we'd like to revisit that and just make sure that we're getting the broader community, activity. And I think there certainly could be something on the bike education, that type of thing like this, because I don't want to leave out community members, and children from that.
Yeah, thank you.
Any other questions or comments?
All
Thank you. I
right.
really appreciate the information that I'm going to take time to digest, and I may email you some of my questions later.
Please feel free. Thank you so much for your time.
I
This was-
appreciate the report. Thank you so much for coming.
Very good.
Thank you for having us.
Yeah.
We will leave you to the rest
Yes.
of your meeting.
Onward.
Okay.
If I may, quick before you leave, just want to offer gratitude as well. Hartley, Hannah, Kate, Andrea, Grace, everyone who's a part of doing this work that isn't represented here today. It's really remarkable what you've been able to do over the last year. This is not to mention all of the work involved in responding to questions from community members about the pandemic, vaccinating thousands of residents. It's just really incredible what has happened over the last year and many, many years prior because of this wonderful partnership and relationship. So thank you all so much.
We're a pretty good team.
Yes, you are. Okay, we will move on to the next item of our agenda, our staff updates and agency updates.
Oops. It's great to be with you all in person today. I have a few staff updates. We are conducting interviews this week for our public health educator position. This person will be supporting our public health emergency response, recovery, and preparedness work. And we are starting to see cases rise statewide again with the Delta variant, which is considerably more contagious, becoming more prominent. So we're really, really grateful to the support of this board for allowing us to maintain capacity to continue to provide our public health response. In Human Services, Melissa Becerras was hired as our Substance Use Disorder and Co-occurring Disorders Case Manager. That hire was approved at last week's regular meeting of the County Board, and Melissa will be joining us in mid-August. Finally, we are recruiting for a Family Services Case Manager within the PHHS department. This is a position that was vacated by Cooper Turnus as he was appointed into the Children's Mental Health and Therapeutic Support Skills position that was vacated by Matthew Baxley. So the application period for Cooper's position, the Family Services Case Manager, closes on Friday of this week. And once the dust settles with all of our staffing changes, I'll be sure to bring an updated org chart to a future board meeting so you can keep track of where we are as a department. Any questions on staffing updates before I move on? Okay. Agency-wide, so in public health, we are applying via the Regional Community Health Board for an MDH grant, which will support our ability to expand into healthy housing work in the community. This grant would help build capacity within our public health team and with community partners to address housing as a health issue. This is one of the priorities of our community health assessment and improvement plan. And within this program, it would provide grant funding to train our public health staff to conduct health risk assessments in homes and connect residents with tools and resources to mitigate health hazards within their homes. So things like radon, fall hazards, connecting people with services available through our environmental health or perhaps through FireWise. So really forming that linkage to existing resources to help residents feel supported and healthy and safe in their homes. The other major project underway in public health is planning for a back-to-school vaccine event and mini health fair. And this is scheduled for August 11th, and we'll be getting more information out to the community in the coming week. Within Human Services, I want to give a recognition to our economic assistance team, Agni, Dagmara, Ellis, Kathy Ann, Sarah, and Katie and Allison Plummer for meeting national timeliness thresholds for processing food support applications in Q1 of 2021. Cook County was one of just 19 counties statewide that received a certificate of achievement for reaching those thresholds. So really proud of the continued performance of that team. We are also promoting the Minnesota Benefits online application portal system. It's a new way to apply for some of those cash and food support economic assistance benefits. It's a streamlined application process, very mobile friendly, takes a fraction of the time to go through the application process, and we're starting to see more applications come through. So excited about that. Also within Human Services, we have brought together our multidisciplinary team of partner agencies and staff within the department who are involved in responding to people experiencing a behavioral health crisis. So this is a coordinated effort between our law enforcement partners, Human Services staff, both within PHHS and Grand Portage, some other service partners including the Violence Prevention Center, our ER staff and leadership, to talk about how we can continue to improve that coordinated response for people experiencing crisis. We met last week and we brought an individual from a former Duluth Police Department officer who runs a training program and has been involved in a coordinated response effort within Duluth to share some experiences with our team about what has worked well and connect us with ideas for continuing to improve that system locally. We have completed the survey of residents on transportation needs in the community with the support of Sarah McLeod, who's an intern, social work intern with our department. Sarah presented last week to the North Shore Healthcare Foundation, who has a shared strategic goal around addressing transportation, healthcare access, transportation needs in the community. And we anticipate having Sarah join a future PHHS board meeting, perhaps even earlier this fall, to share her findings and to give an update on some grant and program opportunities that we're pursuing as a department. Want to just give a note regarding the financial report that you approved on the consent agenda, that at about halfway through the year, we're right where we expect to be, at about 40% with expenses and revenues, given the delays with billing and reporting at a state level. And my last update is just a reminder of our next meeting. We have a special meeting on August 3rd, so just 2 weeks from today, and we will be presenting the 2022 PHHS department draft budget. Same time, same place.
What day is that?
August
3rd. Tuesday.
A special meeting of this board?
Of the Public Health and Human Services
Glad that you
Board.
reminded me.
And what time are we meeting?
8:30. And
Okay.
those are my updates.
All right,
Happy to
well,
take
thank
any
you.
questions.
How come we're moving so fast this morning? Am I not asking enough questions? I did a lot more reading for this one. Okay, just. All right, we will move on then to, we don't have any items for board action because we took care of that at our last regular meeting. We'll move on to our committee reports then. Commissioner Svaleson, you're up first.
Yeah, and actually, we covered the majority of it already in Andrea's presentation, so you did a fantastic job of going over my...
And you're welcome.
That's right. I'd like to tell you we coordinated that, but we didn't. And in our next meeting, when we do the committee of the whole, you'll see the incredible amount of detailed work that's been completed on the Safe Routes to School initiative and the actions that are being promoted coming from that survey. So just a little teaser there as we move forward in the day. That's it.
Okay, thank you. And Commissioner Mills is not with us this morning, so and he has a lot of
Yes, he
committees. Administrator Yorkie, do you have any knowledge of any of the ones that Commissioner Mills that you want?
I'm not
No, okay.
prepared to report on
All
that.
right.
Sorry.
Just wondered. Okay, then we'll move on to the Arrowhead Regional Corrections, and unfortunately, it still says Ginny as the alternate, but
I
that,
apologize.
yeah, that's Commissioner Svaleson and I had to miss the last meeting because we were at the AMC convention. But I'm just wondering, Commissioner Svaleson, do you have anything to report about? You were also on the budget committee there.
Correct, and the budget was put forward and has been provisionally approved, and it will be coming out here soon for each of the counties to see there. So nothing shocking on that end, and that's a very good thing.
Okay, thank you. Then we'll move on to ARDC. Mr. Storlie.
To report specifically because 4 times a year we have a general commission meeting, and that involves many people in the Arrowhead representation of people with in cities of 10,000 or less, and so it's a wider and bigger meeting than what we normally have, but so that we just had one, and nothing in particular to report from that.
Okay, thank you. Local Advisory Council for Mental Health.
Yeah, so we met on July 13th. We spent quite a bit of time talking about employee burnout. It was later in the day from that commissioners meeting that you guys held. So we spent a lot of time talking about, employee burnout, and sort of came up with the idea that maybe between the Mental Health Advisory Council, the Public Health and Human Services Advisory Council, and then the resources within the SHIP program, we could come up with a sort of what I'm calling a pilot project, because I don't have another word for it, to provide employers and their employees resources, to help work through burnout, prevent burnout, things like that. So that's really, beyond the typical EAP program that some employers do have. And then we also talked about sort of the barriers to some EAP programs as well, and how this program could potentially work in conjunction with that to sort of eliminate, or I shouldn't say eliminate, but troubleshoot some of those barriers. And then we continued our mission and vision process, but we got to the point where we are ready to start drafting statements. So the members were asked to try, if they felt comfortable, excuse me, bring draft statements to our next meeting that we could work through. We decided that we would do the vision statement first, start with the broader umbrella, and then work on the mission next. So we're still weaving that in with, projects that we would like to support and community discussion.
Thank you. Yeah. So I have a question about reaching out to employers. Do you have an idea of what type of employers or how to reach out?
Well, initially, all. Everyone.
Good luck.
I know, right? Well, the initial conversation came up from maybe trying to work with the county to complement some of the programs that were already started through the pandemic. But, we didn't actually solidify that as like the first place that we would start. But potentially any employer, or if there are people in the community who feel like they have other coworkers that would benefit from that. It doesn't have to be, it wouldn't have to be based like through the employer. It could be necessarily, it could be just, it could be broader than that. Or we could work with specific employers such as as an example, Cook County or any Sawtooth Mountain Clinic or, whatever it might be.
Yeah, and I guess I'm asking the question because I know some business owners who are experiencing a lot of stress right now. And so
Right.
it's stress for themselves, it's stress for their employees.
Right.
And so I want to make sure we don't exclude employers,
Yeah.
self-employed people in
Right,
that
I
group.
agree. And through the SHIP program, I also participate in the Grand Marais Business Coalition meetings and the Pandemic Economic Response Team meetings. So through those committees, I've developed some pretty good working relationships with some local business owners. But if people out there want to reach out to me, I would be more than willing. I mean, I have resources already that are available. Just this would be maybe a more comprehensive wrap-up of resources instead of just random, try this, try that.
Okay.
Because I have lots of those right now, if people are interested.
Okay, well, that's
Yeah.
good to know. Thank you.
Yeah.
Yes, go
One
ahead.
thing that struck me in the conversation during that meeting was how the EAP counseling and therapy availability is not very good. And when people need therapy and assistance and other kinds of support, they need it now. They don't need to jump through a bunch of hoops or run into a lot of barriers, like you can only do so many meetings, or you have to change your topic each time. So I think that's something that could really use a good looking at, is how we can widen the support services within the system, or maybe in addition to the system. But that's something that does need to be considered, because people do need help when they need it, and not just in a very narrow.
Right.
method.
Thank you. Okay, let's see, I'm kind of lost where I was on my thing here. Oh, restorative justice, that would be me. We did not have a restorative justice meeting, but they formed a subgroup of truancy. So I attended the first session of that. They're looking at truancy with the schools and the court system here, and working on seeing what restorative justice can do to be part of the solution of that problem. So, and we have a meeting next week, our second one on that one. Council on Aging.
All right. Well, first of all, thank you, Andrea, for helping the Council on Aging with their reopening plan. Things are going very smoothly, and we so appreciate your support with the organization. It's been fantastic, so thank you. The group is continuing to work on revising documents and centralizing the location of everything for the hub and first and second, all with the Cook County Council on Aging at the hub. And they're also in the process of finalizing policy work and bylaws, and they're working on expanding their use of technology. They just purchased an owl, and if you're not familiar with what an owl is, it sits in the middle of a room like this, and you get a 360-degree angle of view of everyone in the room, and it's got a great microphone system, and so when you meet, it's that solution for having a hybrid meeting. People can be in the room, they can Zoom out, and so that piece of equipment has arrived and is going to be installed and should be ready for our next meeting, so that's really exciting. They've executed their reopening, which Andrea helped, and again, the foot care was a huge success. It was fun to walk into the hub and see people playing bridge again. There's tech support for seniors, and the meal service just continues to grow, and people are enjoying not only their meal, but getting back and socializing with their peers. So a great success. And they recently received their payroll protection forgiveness letter, which was a huge piece, and then they were awarded the North Shore Healthcare Foundation Award for $1,000 or a little over for their medical loan program. So they're going to be purchasing new equipment and are very excited to loan that out to community members in need. So lots of great progress.
That's good to hear. I'm really happy the hub's back open.
Yeah.
Could I add just a little bit to that, Ann?
Absolutely.
The hub was very helpful for the Library Friends Board in setting up for the recent pop-up book sale, and we were able to gather our books there on a couple of afternoons, and they also allowed us to store them in the garage. And I don't know if I should say this yet or not, but the next pop-up book sale is going to be September 25th, and it's going to be at the hub. So they were very, very helpful for that process.
Well, great, and it's fine to sneak that commercial in there. That's okay.
Thought it might be.
All right, great.
All right, we'll move on down to Healthcare Planning Committee.
Emergency preparedness?
Oh, emergency preparedness. Okay, Ann.
All right, so I'll continue. Just some statistics from our meeting last week. Grace shared that 71% of our county is fully vaccinated, and our case count at that point was 175. So again, we continue to be the greatest in terms of vaccination in the state and the lowest in terms of cases. So we're in such a good spot. And Emergency Operations Center has closed, which we know, and we're just focusing on preparation for the Delta variant and how it's going to impact us as a community. And the other real big focus of the meeting was the fire danger, which we can all smell. We know the smoke has been incredible. We have fires in the Boundary Waters. There's 7 fires just across the border. Everybody's on high alert. And so lots of teamwork and behind-the-scenes work to keep our community safe and to also keep our community prepared. So I want to thank everybody for their work together to keep us safe and to help communicate with people in the Boundary Waters, entering the Boundary Waters, and staying at local resorts so that they are aware of the situation.
Okay, thank you. Now we'll move on. Sorry
That's
about
all right.
that.
That's all right.
Healthcare Planning Committee.
We've not met so far over the summer. Maybe in August we might, so
Okay.
then I might have something to report.
How about NACO? They had a big meeting.
I'll report on that. As you know, I was virtually a part of NACO, which was also in person and virtually. So I'll just go over some of the health proposed platforms and resolutions. There were over 22 of them, and I kind of picked out just a few that would be more relevant to us in our area. And the whole point of this is these are discussed in the summer, and then when everyone meets in Washington, D.C. in March, then they whittle some of this down and hopefully get it passed. That's what we want done. Okay, so I'm going to go to page 4. First one is a resolution on support for supporting and improving rural EMS needs. And I know that when I attend the township meetings, there's usually some request for equipment and that type of thing in just our small little area. So NACO is urging Congress to appropriate $20 million for a program called Siren. And that's a grant program that will provide funding for rural fire and EMS agencies to recruit personnel, to train, and medical supplies, and so forth. So I thought that was really important to know about that in our rural area. Let's see. So the next resolution I thought was important, a resolution supporting a joint state, local, tribal, territorial, and federal COVID-19 pandemic after action report. So whenever we get to the point that we're after, NACO encourages Congress and the President to charter a commission to prepare a complete account of the public health response to COVID-19 pandemic. And that includes all of that I said above, state, local, tribal, territorial, and all of that, which would be really important to work on that because the future is pretty doubtful that we're ever going to be done with pandemics, but we just want to get done with this one first. The next one is a proposal resolution on declaring gun violence as a national public health crisis. And the proposal is for the NACO urges the federal government to work with local community and government agencies to identify specific activities such as gun violence, to work with local law enforcement agencies, and to increase funding for reducing gun violence. And my last one. Proposed resolutions supporting mental health funding and programs. And that's what we talk about so much, is the funding of our mental health programs. NACO urges Congress and the administration to prioritize mental health care that enhances counties' ability to provide local systems of care, increasing funding for mental health programs, substance abuse, mental health services, Veterans Affairs, and supporting set-aside mental health funds for each state and county and local governments. There was several supports for veterans and several supports for jail situations where the mental health of folks in the jail need to be concerning. Right now, we don't keep them any longer than 72 hours. That's not to say they don't have anything when they come in, but most of the time it's they're moved on to another facility. But that is a big concern in the nation. And I'll just follow up with a little comment about, I would mention that on the WIC program. That was a big deal many years ago, and look where we are now with support of the WIC program. We don't even have it mentioned anymore. You know, it is funded by federal and state, and so we move on in our social events, don't we? You know, and the other thing that rises to my thought is that, you know, here's the deal. We're sitting here and you're the grassroots. You know, we're the grassroots here. And this is kind of all up there, you know, with the president, please, the Congress, please do these things. But we're the ones that bring it to their attention. That's how NACO works. We have all these, even AMC has the platform when I attend the health committee meetings there, and I bring that to the NACO conference, and so everything kind of slides up, and then we hope it doesn't stop when it gets to the Congress. But we keep working at them. You know, Senator Klobuchar and Senator Smith, I've met with them, and they appreciate coming from Minnesota themselves what our concerns are in Cook County. So it's never ending, but it's always kind of putting along, making levels of increase and hoping that you can improve. So that was a really good, I would say, interesting way of doing the conference, because I've been able to attend a couple of them in person, and it was amazing their technology reaching all across the United States to over 3,000 counties. So thank you for letting me go.
Well, thank you for being
table.
Did you get to vote for Mary Jo McGuire?
Oh, you bet. Yes, definitely. That was part of the deal. That's why I wanted to be there.
That's good. Now Minnesota representative on the.
I know. That's a really big deal to have somebody from Minnesota represented as second vice president to NACO. So we'll maybe not see as much of her, or we'll see a lot of her. Because I know she's been in training, just all of her responsibilities, because she will be going to Washington, D.C. a lot. And maybe she'll do things virtually too, who knows. But, well, I'll have a chance to visit with her in December when we have our big state conference.
We were able to meet her down
good.
in St. Paul. Yeah,
Oh,
so there
great.
was
Okay.
a lot of cheering going on.
Yes, I'm sure of that.
So thank you. Okay. Job training program. Well, that's Dave.
That's Dave.
North Shore Collaborative. If you have any information, because you also serve on a committee, feel free to step up and say something.
If
Otherwise-
I may, Commissioner, I
Yeah.
do attend the North Shore Collaborative and the Arrowhead Health Alliance as
Thank
a
you.
member of the coordinating council, so I can provide updates on those
Thank you.
too, if
Great.
that's all right. This one's easy. North Shore Collaborative has not met. We meet next week, in 2 weeks, on the first week of August. The Arrowhead Health Alliance joint powers, so jumping back a bit, we met last week or 2 weeks ago, and the AHA board, which is made up of commissioners throughout the region, approved entering into contract negotiations for our regional after-hours crisis response, as well as for Duluth and the 30-mile radius. And this is the first time in many years that we have had a competitive RFP process for that service. So there is the possibility that that could impact how that service is provided here in Cook County, but this would not be until next year. And it's something that both I, Commissioner Mills, and Grace Bouchard, who serves on the Arrowhead Behavioral Health Initiative as our Supervisor of Children and Family Services and Behavioral Health Services, are well connected in with and have been a part of that process, and will continue to provide updates both to the board, the public, and our community partners as there are any changes in how that after-hours crisis response service is provided locally.
Thank you. When I was down at AMC, was able to have some conversations with commissioners from other counties and learning what they're doing in their county about this. And wow, there's a lot happening out there and a lot to learn about that. So I'm excited that we have a regional group that's kind of looking like maybe we can make it happen here. That's exciting.
And a comment as well to Commissioner Sullivan's point about the OWL technology. That is a piece of equipment that we have within Public Health and Human Services and was made available to us through our regional telepresence for behavioral health. We used it last week at the local Mental Health Advisory Council with mixed results for that hybrid meeting, but we're confident that we'll be able to make that work for hybrid meetings for both of our councils going forward, including the PHHS Advisory Council in September.
Okay, thank you. And then we'll move on to the Public Health and Human Services Advisory Council.
And you have my notes.
Yes, thank you for that.
And also, I just wanted to point out that Andrea and Hartley and Taylor from American Lung Association attended the city council meeting last week and worked with them around the T21 project, and it looks like it's going to fly. So I know that Andrea and Hartley and Taylor have worked real hard on that and deserve some credit, along with the Mental Health Council and the Public Health Advisory Council. So, nice.
We appreciate the support from both councils.
Yeah.
Thank you
It's-
for your work on that, yeah.
It's been a while coming, but it's good. That's all.
Okay. Anybody else have any other comments or?
I have a few
reports? Go
thank
ahead.
yous.
Yes.
Through my work with the Council on Aging, I'd first of all like to thank Andrea for her oil and popcorn and kind of providing the opportunity for celebration as we reopen and get back to normal, and to thank all the people who have contributed to Meals on Wheels as they've been delivering through the pandemic and continue to provide Meals on Wheels. And to Donna and Orvis Lunke for their food distribution. They do the food boxes, and that's been great. And to S.J. Bouch, who have put in time and materials developing parking signs for down at the hub, but helping us as we get busy down there to be in good shape so we're safe and orderly. So thanks to all those folks. They make great contributions to our community.
Thank you. Nothing else? We'll move on. We have our special meeting. Oh, I'm sorry.
Just a reminder
Yep.
for the board and for the public that last week at the county commissioners meeting was the last update that Grace was providing from the EOC and public health to the commissioners, and going forward beginning in August, those updates will be folded into our regular updates to the PHHS board.
Okay, and I think we all know we're going to come for a special meeting on the 3rd of August at 8:30.
We do now.
And so if there's nothing else that we need to report, I'd like to point out that we're 10 minutes before we're supposed to end. You know, we
Well,
made it.
Actually, no, the board has approved the cow to start at 10:30 now.
Yeah.
So.
Which is
It just
nice
didn't
for us
change
to.
on the template.
Right.
Right.
But we
So-
made it by 10 is what I'm kind of excited about.
My hat's off to you.
I'm doing better.
That's
I'll
right.
get better too. All right, so if there's nothing else, do we have a motion to adjourn?
I'll motion.
Thank you.
I'll support.
Thank you. All in favor?
Aye.
Opposed? We are adjourned. Thank you very much.
So Roger, was the sale really successful, the book sale?
I just wanted to mention,